afternoon. My name is Carlian Odae, and I am a Master of Public Health student at the University of Pennsylvania. And for the summer, I've been working with Children, Youth, and Family Services within the Department of Health and Human Services.
Terrific.
And for my research project, I posed the question, is East County a resource desert? So for the purpose of my study, for the purpose of my project, I analyzed HHS services specifically in East County to help develop strategies to improve outreach methods and community engagement. I researched the services available and administered surveys to local community members and local partners in East County regarding awareness of services. So I'll first start with a brief overview of East County. It is the eastern part of Montgomery County and home to a little over 100,000 residents. 71% of the population is a part of the minority demographic, and the top 3 countries of origin for the immigrant population is from El Salvador, Ethiopia, and India. I think it's important to understand the demographic in the area that you're working in order to tailor an approach that is effective to conduct appropriate outreach for the community members. Similar to all the different regional areas in Montgomery County, East County has a regional service center. And this is a service hub of different partners that provide a plethora of resources to the community members. And on the bottom right-hand corner, you'll see the hours of service, the hours of operation of the East County Regional Service Center. As you'll notice, the only entities available on Monday are the care coordinator and the WorkSource Montgomery. And these entities are only available to see clients who have appointments. Except for those exceptions, the building is shut down and is not open to the public. In addition, HHS has spearheaded an initiative called the East County Opportunity Zone. It's composed of 4 main entities and four main committees that are composed of local and governmental agencies, and all the logos that you see are partners that are working in those specific committees. After reviewing the plethora of services in East County, I asked myself again, is East County a resource desert? I came to the conclusion, no, it is not. The issue seems to be community awareness, which was highlighted through the questionnaires that I conducted and the surveys that I administered to local partners and community members. To improve community awareness, I've made up 4 recommendations based upon the responses that I received. And first, I think it is appropriate to ask to fund the East County Regional Service Center in order to provide staff members during regular business hours, let's say Monday through Friday from 9 to 5. Given the demographic of East County, consistent hours, human personnel, and having a person to talk to will significantly increase the utilization of the service center. I also recommend updating the East County Regional Service Center webpage to include location, services, and hours of operation. This is based upon feedback that I received from community members who expressed the difficulty of using the county's webpage to access these information. Third, I recommend a grand reopening of the Regional Service Center and appropriate signaging to kind of highlight where the service center is and bring awareness to the community members that this is their this is their regional service center, and understand the services that are available and when to access them. And lastly, I recommend collaborating with local agencies to offer community-based events in East County. With the lack of community knowledge regarding services, going to targeted neighborhoods in East County will initiate a relationship between local partners and community members and enhance their likelihood to reach out to HHS services in their time of need. These are my recommendations on ways to improve community engagement in East County. Thank you so much for your time.